One of the most daunting challenges that we face is climate change. So let me be very clear, just to gain some time. Climate change is real, and it's linked to human activity. If you don't agree with these facts, you're going to have a very hard time this evening. Mozambique was flooded twice just last year within a month. More than 500 tornadoes hit the United States just last month. Parts of Serbia are flooded as we speak, while India is facing a severe drought and record heat. Just 3 days ago, it was 50 degrees in Rajasthan. Think about that the next time you're on the subway. Closer to here, just last year in October, 10 people died in the département de l'Aude after flash floodings. The consequences of climate change are dire, and they're already affecting communities all around the world through drought and extreme weather events. Some research also show a link between climate change and political instability leading to violent crises. And because this climate crisis is real, BNP Paribas has been taking actions for a few years now through its CSR programs, the BNP Paribas Foundation, and its endowment fund. The impact of climate change has led the humanitarian community and humanitarian response into a major transformation. And this is what we'll be discussing today with 3 experts. The first thing we need is to understand this new humanitarian approach, and it is to study climate change and its impact on communities and extreme weather events. Such is the specialty of our first speaker today. He's a professor at the University of Cape Town and the director of the African Climate and Development Initiative, which is a research program funded by the BNP Paribas Climate Action Fund. He also holds an AXA research chair. He was just named one of the 100 most influential people in climate policy. So please welcome Mark New.
Thanks very much, Alex. So 5 minutes to tell you a whole lot of complicated things, but I'll do my best. What you really try to do within our broader research program at the African Climate and Development Initiative is figuring out how to respond to climate change in Africa. And that both means leveraging of opportunities, but also reducing and managing the risks that climate change presents. Now, within that broad area of research, I wanted to cover one area of focus, which is an area that I particularly work on, which is trying to understand how the risk of these damaging extreme climate events and weather events is actually changing. I think the easiest way to do that is maybe to start off with an example. So I don't know how much Cape Town was in the news in Paris in the last couple of years, but in 2018, Cape Town nearly ran out of water. We had something called Day Zero, which was a day in about March 2018, where if we didn't have any more rain to fill our reservoirs, the whole city would have run out of water, and there would have been enormous social and economic consequences of that event. So a lot of the debate then was what caused Day Zero. And it's, as always, never particularly simple, but Cape Town is a rapidly growing city. The population of Cape Town has grown by 25% in the last 10 years. So there's been an increasing demand on water from the water supply system. But then in 2015, 2016, 2017, we went through 3 of the driest years on record. So 2015 was the 3rd driest year historically, 2016 the 2nd, and then 2017 the driest year. So we had 3 years which were the driest historically. And what that meant was that the reservoirs, the dams in the water resource system never refilled properly because during the rainfall season, there wasn't enough rainfall to compensate for the water that had been used in the dry season. So each year, the levels of the dams went down and down, so that by 2018, at the end of the 2017 winter rainfall season, in early 2018, the reservoirs were at about 15% capacity, and they had to see us through to the next rainfall season. And actually, of that 15% capacity, only 5% was actually usable, because the last 10% you can't actually abstract. So we're sort of threatened with the situation that eventually we managed to just about escape by going into emergency water saving restrictions. And the city of Cape Town reduced its water consumption by 50%. So in the height of the drought, half of the water that was being used was half of what it had been before the drought. So one of the questions that then gets asked of climate science is, well, is this drought due to climate change or not? And that's the kind of research that we try to do, is to try and disentangle the role of natural variability in climate and climate change in producing these extreme events, whether it's a drought or a tropical cyclone or a heat wave. All of these today, because we have a human influence on climate, are a complicated mix of both natural variability and the way that humans are affecting the climate system. So to do this, we use a field of climate science called attribution science. And what we're really trying to do there is figure out what proportion of the risk of a particular event, like a drought, is due to natural variability in the climate, and what proportion is due to human influence of the climate. So to give you an example of how that might work, we come up with this term called fractional attributable risk. So I want to give you a different example to explain how that works. So can I ask all of you, who in the audience has smoked cigarettes for more than 1 year of their life? Could you put up your hand? Okay, so that's about, say, 10%, 15% of the audience. Now, we can actually work out the fractional attributable risk that smoking is playing on your life expectancy, for instance, by actually taking 2 samples. We can take a sample of everybody in France who smokes and everybody in France who doesn't smoke. We can look at the sort of average age at which people who smoke and don't smoke die, and we can say maybe, I don't know the exact figures, but maybe your life on average is 5 years shorter if you happen to be a smoker. So the fractional attributable risk to smoking is 5 years. 5 years, that's the difference between those who smoke and don't smoke. So what we can do the same with climate change. We could say the world is smoking. It's giving off greenhouse gases. We're burning fossil fuels. And we can say, what would the risk of an extreme event have been if the world wasn't giving off those fossil fuels? Now, unfortunately, we don't have a second world where we can sort of split the sample and look at people who smoke and don't smoke. So we have to go into sort of computer modeling, but we can run computer models, the same models that produce weather forecasts, where we can take out the climate change signal, we can remove greenhouse gases from the model, and then look at how the likelihood of a given event would change in a world without greenhouse gases. And that's the attribution work that we can do. So for instance, for the Cape Town drought, we could run these weather forecast models with and without greenhouse gases and look at how severe the drought would have been in a world without greenhouse gases. And we can show that the risk of a drought of that magnitude increased by 300%, 3 times more likely. So because of human influence on climate, the Cape Town drought was 3 times more likely to happen than if we hadn't had climate change. So what that really means is that the way that the water resource system, the way that risk was being managed for Cape Town was actually based on the wrong assumptions. So a lot of, historically, when you're managing risk, you think the past is the key to the present and the future. And the way that a water resource system is managed is they will look at the frequency of drought events in the past and then design their water resource system to be reliable to a certain level of assurance. In Cape Town, it was a 1 in 50 year assurance. So you would be in a stress situation once in every 50 years. And that's because you can't totally climate proof any system. You have to just be prepared to cope with a certain level of risk. So what we've shown there is that they were underestimating the risk of a drought of that magnitude by about 3 times. So instead of the water resource system failing once every 50 years, it would fail about once every 15 years, which is an unacceptable level of risk for that management system. So in terms of managing your risks then, it becomes really important to understand how the hazard is changing, because that affects one aspect of vulnerability. Other aspects of vulnerability include the way that the system is managed, other factors like levels of socioeconomic development, the capacity to respond. But if the hazard is changing, then the way you think about the risk must change as well. So I wanted to sort of finish off by then saying, well, what does that mean potentially for humanitarian responses to weather and climate extremes? Essentially, humanitarian agencies are trying to understand the risks that they have to respond to. And again, they're in a similar situation. If the risk is changing, then perhaps climate science can help inform their understanding of how that risk is changing and how their responses might change.
Thank you very much. So, better understanding the impact of climate change on extreme weather, it also allows humanitarian to act in prevention and sometimes mitigation of these crises. And our next speaker is an advocate of this anticipatory approach. She's a technical advisor for disaster risk reduction and climate change adaptation. She's got more than 10 years of experience working with the French Red Cross. Please welcome Thuy Binh Nguyen.
Thanks a lot. Well, good morning, everyone. Bonjour. I'm Bing, and wow, Alex, Max, you already started the conversation very hot, and as you already hear, very, very interesting discussion, presentation of Mark on how climate is changing and how it's changing the risk we are facing. It is the job of humanitarian organization to respond to disaster and to reduce disaster risk. So I am the technical advisor on disaster risk reduction and also adaptation to climate change. I have been working for 10 years with the Red Cross. I started as in a response to a disaster. It was Katsana in 2010 in Vietnam, and after during the disaster response, when we're doing on the distribution of water, filter, of rice, we're asking ourselves, well, but what about next year? There will be another disaster, and what about with all the climate change? How it could be? How can we prepare our community? How can we prepare ourselves for disaster? And that's the reason why I started working in disaster risk reduction, climate change adaptation. And over the last 10 years, we're working in different countries in Asia, Pacific, in Latin America, in Caribbean, and in Africa. And currently, we are working as French Red Cross very much in the two very specific contexts, les petits États insulaires, the small island state, like those in the Indian Ocean, the Pacific Oceans, the Caribbean Oceans, those countries that are extremely exposed to climate change. And the second context, which is very interesting, is the countries in fragile and conflict-affected context, like in West Africa, the countries like Chad, Mali, Mauritania, Cameroon, and also the country in Middle East, like Yemen, Iraq, Lebanon. These countries, which is very interesting that Alex mentioned, the risk is actually a combination of two elements. The hazard, the hazard elements and the vulnerabilities elements. And on these countries like very fragile countries, the vulnerability element is really high, making people more extremely exposed to disasters. And today I would be very much it's really my privilege to be very first time in BNP Paribas and to share a little bit of my experience in the response and preparedness for disaster by the Red Cross.
Thank you very much. So we can study and we can try to prevent humanitarian crises from happening, but unfortunately we still have to respond to those that arise. But even in this emergency response situation, we now must take climate change into consideration. And our next guest helps develop programs to do so. She used to work on climate and environment issues for the French Development Agency and at the United Nations. Now, as a climate advisor for CARE France, her role is to mainstream climate resilience across all of CARE programs. She also manages climate change adaptation projects directly, especially in Asia, giving her a very specific and field perspective. Please welcome Leroy.
Thank you very much. Thank you, Alex, and thank you, BNP, for inviting me for this event. I'm very glad to be here and sharing the stage with this great experts here. So I'm Indian climate advisor for CARE France, and as you may know, CARE is one of the largest humanitarian NGOs in the world. We work in more than 90 countries. And from our work in all of these countries, in all the continents, we have witnessed firsthand a really tangible rise in the frequency and also the severity of climate-related disasters. And these disasters directly affect and impact the poorest people and the most vulnerable people in the world. So we may still debate what are the exact numbers, what are the exact scenarios, and what are the exact links between climate change and these disasters. But we know for sure, and I think it's quite undebated now, that the higher the level of global warming, the bigger will be the impacts. And for us, as my colleague from the Red Cross has said, as humanitarian NGOs, we have been striving for decades to fight poverty and injustice. But now we are coming to realize that our efforts in this regard will amount to nothing unless we also tackle climate change across all of our programs. Because climate change amplifies the existing vulnerability and poverty of the people that we work with. So we really have to focus on this question very strongly. So to do that, the approach that CARE is developing is threefold, or the way we work with communities is threefold. First, we support communities to prevent, prepare, and also respond to disasters. We also support what we call community-based adaptation to climate change. So it's supporting communities to be more resilient to slower onsets events. There are not only disasters, but there are also shocks and stresses that are less visible, but that very severely affect some people in this world. And lastly, we work with communities and with governments to try to influence the policies and the regulations at the local, but also at the international level to get more financing and more engagement for fighting climate change. So just to give you a brief example, with the BNP Emergency Fund, we have received support for an intervention in Madagascar. So as you may know, Madagascar is an island which is extremely exposed to disasters. With this project, we have been working on the eastern part of the island. And from our presence and work there over the last 5 years, we have witnessed that this specific area of eastern Madagascar is stricken every single year by a disaster, by a typhoon, every single year. And with this disaster, 80% of the population is stricken every time. So meaning that either these people are killed or they are wounded, or their homes are destroyed and they have to flee, or their cattle is destroyed and they are left without revenues, or they have deprived from access to basic services, hospitals, schools, etc. So there is really a need to support this population. And what we wonder when we work there, and when we started working there, and when we are working there on a regular basis, is why are these people so vulnerable? So obviously, the geographic location of Madagascar is an answer. They are in a situation that makes them very exposed to hazards. But also, we realize that the population has a very low coping capacity, and this for many reasons. One being that they may not have access to climate information and weather information. But more than that, when they do have access, sometimes they don't know how to interpret it. We work with very remote population. They are not always educated. Some of them don't know how to read. So they will receive an SMS telling them a typhoon is coming, but they don't know how to read. So what do they do with that information? And so there are indeed many reasons. So with this project, we've been working with communities to try to understand the risk. So bringing them very concretely into community meetings together to discuss these are the risks that we are exposed to. What are the most vulnerable community groups? Women are often more vulnerable than others, but also older people, disabled people, children. So how do we protect the most vulnerable? And then collectively with the communities and also with the local authorities, we try to set up early warning systems. So the communities will monitor some specific parameters. For instance, they will have a way to monitor the level of water when it's raining, and they will know that when the water is reaching that red line that they have in a bucket, then maybe there will be a flood. Most likely there will be a flood starting the next day. And then in this situation, what do? And they have an emergency plan that they will have either to flee or to protect their house or to take some specific actions. So this is part of what we do. And in parallel, as I said, we work on climate change adaptation to help the communities diversify their livelihood, their revenues, and not depend solely on agriculture or not only on one type of agricultural production. And in parallel, we also lobby with governments and authorities to ensure that they're providing the right support to help the communities. Thank you.
Thank you very much. I'd like to try and stick to our three-step approach that you've all been talking about, which is understanding, preventing, and then acting. Mark, you started the conversation almost on your own, so I want to follow up on that one. How can we use exactly your research to better inform and transform humanitarian risks?
Well, I think there's a whole range of different ways that climate science can help. But in terms of the sort of research I was talking about now, I think it really is about understanding being able to, well, in a technical sense, quantify the risk. So you can sort of have a feeling about the frequency and intensity of weather and climate events. Then, if you've got that information, then you can start to have risk management, risk reduction strategies, and adaptation strategies even that are sort of appropriate to the risk and the magnitude of the risk. But I mean, one thing I think we always have to sort of understand is that the vulnerability is this combination of what scientists call the adaptation deficit. So in many developing countries, the ability to sort of withstand these risks is partly a function of the fact that these countries are not well adapted to the risks that they're currently facing. And then on top of that comes the changing risk that is arising from climate change. So the response to that has to really take into account both the current sort of deficits, if you like, but also then be thinking about how those deficits are going to progress into the future as the risk changes. So it requires understanding of risk on multiple timescales, the risks that you're exposed to today and how they're going to evolve in the future, because you want your response strategies to be fit for today, but also fit for the future. So you don't lock yourself into strategies that may actually then become not appropriate in 10 or 15 years' time.
But when we talk about risks, it all sounds a bit abstract because we're talking about, an increase in numbers. But you mentioned one of the studies that you led in Cape Town related to drought. Are there other very specific risks that your team is looking into?
Yeah, a number of different ones. One of the interesting ones is still related to drought, but it's around agricultural insurance as one mechanism of managing risk. And we work with an organization called African Risk Capacity, which is an African Union organization that offers what's called sovereign insurance. So insurance to national governments so that if they have a drought, they get a payout that allows them to respond to the drought. And they've been struggling with an issue in Mali and Burkina Faso, where actually rainfall has been increasing over the last 20 years. And the countries there are actually complaining that their premiums are too high because the premiums are calculated on 30 years of data. And the 30 years of data include a very dry period where we had all of those famines in the late 70s. And so a question is, actually, is the climate changing for the better in those areas? Because if so, then maybe actually agricultural insurance is not such a, well, should be cheaper because the background climate is changing for the better in that instance. So I'm just sort of giving a flip side of it, that maybe climate change isn't always a negative thing. In some cases, it may actually be positive. But some of the other areas that we're working on are wildfire risk. So we're trying to understand how climate as a driver of wildfire risk is changing. Particularly in South Africa, we've had a number of really extensive wildfires that have caused billions of rands, so that's hundreds of millions of euros of damage. And the question really is around climate as a precursor to that, and it's a very complex precursor. It's around temperature, it's around moisture, wind conditions in the lead up to a particular fire event. But are we seeing a change in those drivers that then interact with other factors around fire management that change the wildfire risk, for instance?
Drought and wildfires seem to be very, easily relatable to climate change. But even when you respond to other humanitarian crises at Care International, now you take climate change into action. How do you do that? What does that exactly mean?
Yeah, that's right. Now we're trying to see climate change. Climate change in care is not an area of our work per se. It's more like a transversal approach. So we have two transversal approaches, actually, one being climate change and the other one gender. And we consider that these two elements are crucial to be considered in all of our interventions in all sectors, and that climate change will have an impact on our capacity to make a change in education, in health, in women empowerment. So we always try to have this as a transversal approach. The way we do it is by trying to develop what we will call a culture of risk or a culture of resilience. And we have some very specific tools for doing that. So we have a simple checklist that has to be used. It's systematically being used by any team that is developing a new project or that is implementing a project on the ground, no matter what country, what sector, what vulnerability to climate change they have. And it's asking them very specific questions on what are the risks that the communities that you are looking at is exposed to. What are the most vulnerable groups, and did you conduct a vulnerability analysis? And then did you plan contingency plans in case of an emergency or disaster? And with this, we're making sure that we have all of these questions always in the back of our minds, and that climate change is not going to hamper our progress in different areas of work.
There's a paradox here, which is, for humanitarian purposes, the climate change is a crisis we can predict. We know it's happening. And thanks to some of your research, we know when it can happen and sometimes where. So what does that mean in terms of prevention and mitigation? Binh, this is one of the fields you work in. Does that mean now that you can take a preventive approach? And what does that mean for you as the Red Cross?
Just in this, I'm very much passionate about these questions of anticipatory approach, because I myself have been working long in disaster response, and honestly, we are always late. By the time the disaster strikes a community, by the time it hits the headline, by the time we start to get to the journal, to BNP asking, yes, we have this number of people affected. By the time BNP people have the meeting, decided, yes, we need to support the community. By the time the money reached the community, normally we are 6 months late. That is already very efficient. So, but we all know, and every disaster, we do more or less the same thing. We distribute water, we distribute food, we distribute household kit, we even cash distribution. We do more or less the same thing. We know where our communities are, but we are always late and people are always suffering. And with the climate change, we're running after even worse and worse. So the question is, with the forecast, with the risk, with our knowledge, why we have to wait until the disaster strikes to make the actions? Why we have to wait until the first person die to say, let's save the community. And that's what we are trying to do in forecast-based financing. Basically, forecast-based financing is trying to shift part of the disaster response, normally after a disaster, to before disaster, based on a forecast. For example, if you know, given the weather forecast, you know that there will be a likelihood of 70% of flood in Mozambique in 3 weeks, in 1 week, let's say. Already, you can already start to distribute aqua taps, a very simple, small tablets that help people to purify water, which is very cheap. You can do blanket distribution, but at least 3 or 1 week right after the floods, people have it. Or for example, if you know already in advance there will be a huge typhoon, and you will definitely like to do cash distribution because the market is functioning. Normally the time to set up the cash distribution via the bank system, it takes from 3 to 6 months. If we do that only in advance, 1 day before the disaster, we trigger the amount, the bank make on the transfer, money arrive in the account of beneficiaries, right 2 or 3 days after the disaster, markets start functioning, people already have money to buy things. So that's what we call anticipatory approach, and this is how I think humanitarians have to change the way we are working, that we need to move more from a responsive approach to be more predictive, more anticipatory, based on the forecast, because we have the forecast, we have the knowledge, we know our people.
And I assume if you predict and if you work in advance with the forecast-based financing, is it more cost-effective?
Actually, indeed, it's very cost-effective. We all know in our humanitarian sectors that actually $1 invest in advance save $6 invest later. Just, wow, I think you are on the very economics people, so just see, that's the reason why, yes, there are some cases that we say action in vain, like we trigger the actions, but disaster did not occur. That happens. But so that's the reason why we need to calculate the activities in a way that even there is no disaster, it still benefits the community. For example, awareness raising, rehabilitation of borehole. But at the same time, we know that even action in vain, the cost benefits of pre-actions is always much higher than response.
So let me get this straight. It works better, it's more cost effective, and it relieves people who are suffering in a faster way and in a more predictive way. Why is this not happening everywhere? Does that mean that the people who can donate money or who can trigger that response, do they wait to see suffering on TV to act? Is that what it means?
Well, I think it's. I
mean, besides BNP Paribas, who's holding this conference, who's acutely aware of that issue and who has a fund that actually works in this field, I'm talking about other people.
I think it's quite straightforward, the logic that we need to prepare, like we need to buy insurance for our properties. But sadly to say that we are human beings are easily touched by image, by disasters rather than touched by the preparedness. And although we are heading there, we are moving there. The Red Cross has been piloting this forecast-based financing for the last 5-6 years. We have the Agence Française de Développement already started to fund some pilot project. The European Union, the German government, British government already started to pilot. So we are going there. But if you can compare the investment for preparedness to the investment for response, we are less than 10%. So it is a paradox here, and I think we need to work on it. I think even me, myself, for example, every day in the morning, I look at the weather forecast to decide whether I will take a raincoat or I take a vest, but many people just ignored it. And we need to build what Marie said, we need to build the culture of risk, not only in the target community, but here among us, so that we can work better together.
I want to stick with the finance aspect. And you've just mentioned that your work helps calculate premiums. Tell us a bit more about that. That means that when countries want to take a risk insurance, they might ask the international community to pitch in because global warming is part of these new risks. Is that what you help do?
So that's not the way the system works at the moment. So at the moment, if, say, the government of Malawi wants to take out a policy for agricultural insurance, they will be paying the full premium, so they'll be carrying all the risk. So what we're working to try and do, using the attribution science, is to figure out, to try and split, is there a way to split the cost of insurance between what we'd call background risk, so the risk that is there regardless of climate change, and then the added risk that climate change brings in. And we would be arguing that maybe in some instances, in terms of a just and equitable response to climate change, the cost of the added risk due to climate change should not be borne by the countries taking out the insurance, because it's not their fault that their risk is increasing. So it's still quite experimental at this stage, but the idea is that maybe then some proportion of the premium could be paid through international climate funds or through donors, through the UN Climate Change Convention mechanisms. Yeah.
I mean, the financial impact of climate change seems like a link easily made, but in your previous expose, you mentioned one aspect that is critical in CARE's approach, which is a gender-based approach to climate change. How are those two fields connected?
Yeah, so it's a very important approach in our work because we realize that climate change is not gender neutral, not at all. It's significantly disproportionately affecting women. And this goes both for slow onset changes and for disasters. So for slower changes, just to give you very simple examples, in the communities where we work with in developing countries, it's usually the women that are responsible for going and collecting the water for the whole family, or also collecting the wood. If you are in a situation of drought, it means that instead of walking 1 hour or 2 hours back and forth every day, the woman will walk 8 hours. During this walk, she will be harassed, attacked. She will be particularly vulnerable. She will become exhausted. She will suffer from pain, and also she will spend so much time doing these household chores that she will not be able to go to school, follow education, or invest time into income-generating activities. And similarly with disasters, some studies have been conducted to show that actually if you look at the victims, the deaths in disasters in the recent years, the proportion of women is particularly high. So it's hard to say exactly what is the reason, because it's a correlation of factors, but it's a combination of social norms, of education, of the fact that very often the women are not involved in the decision-making process at the community level. If there is a community meeting on disaster preparedness, they will not take part because they're not allowed to go out of their house, because they're not allowed to speak up. So all of this contributes to their vulnerability. So our goal with CARE and more organizations are also working on that aspect is to really understand these vulnerability factors and to try and change the social norms at the local level. So we bring together women, girls, men and boys. We get them to sit together and we question the situation and we try to raise the awareness, and they come to realize by themselves that there is this inequality, and progressively we hope to make this change.
We've talked about better understanding, we've talked about better financing, perhaps better reacting. I have an open question to you three, which is there something we can do to limit these risks, to adapt already, to mitigate this risk? Can you help those communities on the ground make the best decisions so that they're not exposed to these factors? You've talked about Madagascar, they're hit every year. What can you do to limit these risks? Should they move?
Yeah, I mean, one thing to say is we've been doing a lot of analysis about what we call a climate adaptation knowledge system. So it's essentially all the knowledge that you need to be able to respond. And there's still a big focus on sort of the traditional climate sciencey kind of things, which is producing a forecast. But actually, as Marie was saying, the knowledge system for response is actually very weak. So one of the best ways we can make a change is to actually provide the knowledge and resources for communities to be able to respond. Often they get the forecast, but they don't know what to do with the forecast information. So one has to think in a much more integrated manner that says you need the forecasts, you need the risk information, but you also need the response information, and then you need the resources to be able to respond. So there's a whole chain of events that have to be integrated together, and I think sometimes these sort of different areas are not integrated enough and don't talk to each other, and so we don't get the full power of what we could be doing.
Just if I can add directly to that, there is also, I think, a very important trust dimension, because if you go to a remote local community, you can just not go and say, hi, I'm a scientist and I know that climate change is coming and these are the numbers. You're talking to people who've been using indigenous traditional ways of predicting the weather, looking at how the trees are blooming or how the ants are walking on the floor, the color of the moon. And we have also to recognize the value of this ancestral knowledge and to build the trust that this is valuable, but the climate is more and more unpredictable, and that it can be combined and crossed with scientific data to their benefits. And that's also a big part of our work.
I think basically that we need to inform people, give people information, we give people resources, and at the same time do not underestimate the capacity of the community building on indigenous knowledge. And I actually have nothing else to add, but maybe to give an example of how we can do that. Within the Red Cross, we are working on a research so-called impact-based forecasting. So normally when there is a forecast, actually, sorry to say, but I think for many people, even humanitarian people like us, it's very scientific. It's too abstract. For example, we say there's going to be a typhoon Cat 2 in Cat 3 in France. What does it mean? What does it mean to Paris? What does it mean to us? We have no clue. Or sometimes we say there is 800 milliliters of rain in Paris. What does it mean? Will the sand will be over flooded? We don't know. So the thing is, like Mary said, we need to say the scientific information in a way that understandable to the community, and that's the reason why we try to cross the data. We use scientific data cross with past historical data, cross with vulnerability of the population to say, for example, if a typhoon hit this village, how many households will be affected? How many households will be under 1 meter of water? Which road will be cut? So instead of we say what the weather will be, we say what the weather will do to you and to your community. And as such, we can help the community to prepare themselves. And we as humanitarian, we also know what we need to prepare. So bridging information, bridging between academic community, humanitarian community, and the exposed vulnerable community is very important. The information, the knowledge is there, but sometimes we have difficulty to talk to each other.
But so we have the information. What can we do in terms of concrete, real actions? So if you're able to say, 25 houses will be destroyed by this coming typhoon. If you're able to say there's be a drought every 15 years and not every 50 years, can we change the crops we're growing? Can we ask people to build houses that are, just higher up? Or again, I'm sorry to be blunt, but should you advise this community in Madagascar who's hit every year because they live on the coast and every year their livelihood is affected and every year they lose people, do you advise them to move? What can we concretely really do on the ground so that when the disaster strikes, we can't just say, oh, we had the data and we told them what was going to happen, but nothing happened. What can we really do to limit the exposure, limit the death, limit the suffering?
just quickly, I think working with the communities to enable them to make their own decisions is really, really important. So for some communities in Madagascar, actually the ties to where they live is much more important than the fact that they get wiped out by a tropical cyclone every year. So then it's around sort of helping them to make, well, working with them to decide what the best strategies are and what their priorities are. Because you know, if you think of some of the examples in the Pacific now, with actually whole islands being evacuated, the damage through to the loss of damage, loss of your home, loss of your cultural background is probably even more damaging than the damage you experience through periodic events. So I don't think it's the job of any of us to tell the communities that they should leave or shouldn't leave, but to enable them to make informed decisions and decide what their best risk management strategies are. The only other thing I would just add is that, you know, climate vulnerability or vulnerability itself is largely driven not by the hazard, but by the underlying structural factors in society. So it's around governance, it's around politics, economics, development. And so we really can't fix the climate risk problem without fixing the broader issues that are affecting many of these vulnerable countries. So I'm not giving a solution, but just looking at climate change on its own is a bit like sticking a plaster on a wound that's about to turn gangrenous, if you like. So again, it's thinking of it from a multi-dimensional point of view and looking at those underlying societal factors that really are driving that vulnerability.
So very quickly, what can we concretely do on the ground to limit the gangrene?
I agree very much with Mark that I think we cannot really put on the same level adaptation solutions, simple adaptation solutions. In Bangladesh, we work with very vulnerable communities where they have set up floating gardens. They're switching their seeds, their types of cultures. They are protecting their houses. They're piling, stocking food, and these are all easy steps to make. But when it comes to actually moving, it has so many economic, social, personal implications that we cannot come and tell the people you have to move now. We can only give them all the information, the knowledge, and the capacity that they need to make their own decision. And on that, we with CARE are launching a research program to better understand the links between adaptation and migration and exactly look at what are these factors that enter into the decision of moving. Because it's exactly not only the fact that you're struck by a disaster, but there are so many other things around that. So we're trying to better understand to assist the communities better.
Besides moving, which I completely understand and of course agree that you can dictate people and say this is what is good for you, but on the ground, are there steps the local communities themselves can take to limit these risks, to already adapt to this new world that we're living in?
Well, I think there's a lot of things they can do, honestly, and it's difficult to say because it's very much context specific. It's very much hazard specific. For example, very simple thing, you can do retrofitting of your house before the typhoon. You can keep your rise a little bit higher up in terms of floods. There are things that people know for a long time. There are things that, okay, normally the water will be this level, but because of climate change, you should foresee it a meter higher. You should be prepared for a meter higher. It's a very interesting question, and we always try to work in concrete, but I think just to try to make it short, we are really working on the concept of building community resilience. So building back better, like the disaster is there, we have to adapt and we need to build back better. We have to understand. We will try, the community resilience is already there. We need to build their community, build it, rather than just to say, okay, the community is resilient anyway, they will survive. yes, they will survive, but which cost? The cost of education, the cost of children, the cost of future, the cost of development. And that's the reason why we cannot let the community alone. I think it's also very important that we as humanitarian actors, we as researchers, we at the private sectors have to work together with the community. But because by the time with the climate change, the disaster surpass the resilience, the capacity of the community, we always need to be there before, during, and after to make sure that the loss will not be significant.
Well, that marks the end of our conference. Thank you very much.